So yeah, that's what's live, and then your mic is there, so you should be ready to go.
Sounds good.
I think you just want to speak out.
Test, test.
I found it the other day in my bag. Shooting and I grabbed my head. And these are washed. I washed them. One paint wash. No. It was some kid's birthday. And I destroyed it. This one, huh?
You know, we have a few minutes before we begin here, so I was going to hope to ask a couple questions if I can. How many of you guys are biology majors in here? Can I just get a quick raise of hands? Okay, got a couple of you guys. Chemistry majors? No one? Oh, that's a sad major, isn't it? How about some nursing majors or anyone interested in medical? Okay, majority of the class here. Any non-science majors hanging out in here? Some Bachelor of Arts students or anything like that? Believe it or not, some of them do pursue a higher science education, some of the PhD, DVM stuff. So, and it brings a different set of skills, which is kind of interesting to think about too. So it shows you these upper graduate programs don't just value only your science things, but they do value your science GPAs if you are going to do that as far as upper level education. Anyone with background in veterinary medicine or interested in veterinary medicine? Okay. Anyone got a dog or a cat? Yeah, there we go. Much better there. Um, Getting closer to our presentation, but I might start introducing myself a little bit. My name is Dr. Sam Lewis. I'm a veterinarian with Rogue Valley Veterinary Emergency. Is a brand new 24-hour emergency clinic over in Medford, Oregon. Is 24 hours, Friday through Monday morning right now. We're hoping to get to 7 days a week. So I started the practice, and I was kind of like, in a section of my life where I was kind of like, well, do I go join another corporate ER? Do I go do relief work, traveling and doing shifts like that? Do I do outside something that I'm comfortable, which is GP work? Well, I don't know about that. I'm an ER doctor. Or do I open this clinic? So I decided it's never going to get easier to do it. And I definitely think that's true. It never gets easier to do something like that. So just do it. So I went ahead and I moved forward and I opened the clinic. It's been a lot of work. It's definitely been very rewarding, and I'm very thankful for the opportunities I've had to do this. So some of the things that I've really valued about doing this is being able to help people when we need it. Our first year being open, we did about $40,000 worth of work for strays, for community members, for rescue groups on the house. Being able to help them when they need it, just because that's something that if we aren't there to help them, then who is? So it's kind of one of those moments where it's do or die in emergency. If they don't have an opportunity to go somewhere else when there's no other 24-hour clinic available for them, well, yeah, you kind of have to step up. My background in education, I'll go ahead and move into the first slide there, is that I am a previous alumni of Rogue Community College 2014. I heard that Dr. Dorothy Swain still is doing some classes here, and I think Helena Smith is also still here, so I'm very happy to see them continuing teaching the next group of students. I still think about those classes and the peers that I had there who used to be my all-time steady group. Stay on campus all day, working on classes and studying things, playing a lot of ping pong over at the Grants Pass campus. Did a lot of ping pong. But that's where I met my peers. So the same group of students, all at the community college level, went on to be dentists, nurse practitioner, myself a veterinarian, one a physician's assistant. So we all went from the very start all the way to higher level education. So it's something that I think starts here, and it's just about how far you want to go. After Rogue Community College, I went over to Oregon State University, where I did my bachelor's in animal sciences. I specialized in sheep and swine, which I never touched again as a veterinarian, small animal ER veterinarian, and I went to school over at Ross University. That's over in St. Kitts and Nevis. Applying for vet school was not particularly fun, I will say. I had a 3.65 science GPA. I applied to about 4 different schools. I got 2 interviews and accepted to 1 school on my first try. The school I anticipated getting into, they were like, no, we've had too many repeat appliers. You're going to have to wait to your second cycle to even have a chance. So a lot of these higher education programs are very competitive. It means that you really have to diversify your background, concentrate on having a good GPA if you're hoping to do that. Following graduation from Ross University, straight into emergency medicine, I went and practiced over in DFW, Texas, where I worked at a 10, 12 doctor practice, got thrown into overnights probably 2 months in as a new grad. That was fun. Following that, I went and practiced over at a practice called Frisco Emergency Pet Care. That was also a 10, 12 doctor practice over in Frisco area, and that's where I gained a lot of my skills as an ER doctor. But I'll go a little more into the differences of what is an ER veterinarian versus a traditional veterinarian and kind of the different roles that we have in veterinary medicine. I got a couple pictures up here. I do see exotics, although I try to keep it pretty minimal just because it requires a lot of specialized equipment, training, and people who know how to handle them. So when I get a walk-in bearded dragon who's complaining about breathing, I'm like, oh great, now I got to figure this situation out. If you see that picture, that's me and my thinking face. That's what I look like. I also put a little picture of me hanging out with my partner. We're over in Japan having a great time. If you notice at the top, by the way, you'll see that there's a Q&A for slides. That way you can ask questions and try and participate in the case studies that I have on here. I'm going to walk us through a traditional ER case and how various levels of veterinary professionals can affect the outcome for it. So that way you can see from where does a 2-year degree like a CVT apply, where does a veterinarian apply, and where does a boarded specialist who's got that additional even 4 more years of education go. So you'll be able to see all of those elements there. I'll tell you a little bit about our clinic, Rogue Valley Veterinary Emergency. We are a little different than your traditional veterinary clinic. Has anyone in here been in the clinic before? Okay, so you guys have seen that we have a very open floor model there. Our clinic has what I call a modified transparent floor, meaning that we don't have traditional exam rooms. We have a couple of private spaces for our hard-to-have conversations or for a fractious animal or an animal who doesn't like other animals. But in general, you stay with your patient the entire time there. There's a lot of benefits to this model, which is why we do it. One of the main benefits for it is that you actually see what's going on in there. You're not tucked away in a little room waiting 4 hours being like, what the heck are they doing back there? You get to see exactly what we're doing. If we're working on a hit by car, a hemoabdomen, some other unstable patient, you understand why we're not able to get to you immediately if you have a minor or mild concern, or hopefully something that's very lighthearted. So that's one of the main benefits there. I also think it helps with having people understand exactly what it is that we do, being able to see how difficult it is to work with a patient who doesn't understand or can't see what you're trying to do with them. That can be very challenging in some cases, and that's why I kind of have evolved the model in a couple of ways around that. The other thing too is people are a little bit more compassionate when they can see what other people have going on inside their practice. So I think those are pretty valuable things. I was nervous when I opened this practice and had this kind of model of, oh God, people are going to see me doing everything that I'm trying to do, and they're going to be like, that doctor can't place an IV catheter to save his life. Well, it's okay because people can understand that every patient's different. Venipuncture is hard. It's not always going to be easy. When you place an IV catheter in a 90-year-old Meemaw that's in the hospital, you're going to be like, oh my God, I can't even see the vein. Those are moments that are okay. People are going to understand that it's challenging. That's why we try that. One thing that I really like about this practice is that I bring my background as a previous IT professional. My whole family are IT people, and I was the one who was like, nah, I'd rather go into veterinary medicine. So I did work in IT for quite a while. I used to be help desk fixing computers and doing things like that. I worked for Oregon State's IT department, for the ag department. And I took a lot of those principles into veterinary medicine, which has been helpful. Designed and made our entire website, including our pet portal, which is a MyChart system for animals, so our hospitalized patients can be followed throughout the hospital. Also made our urgent care board so people can actually see the wait times and where they are in a queue to see when they can get care next. The other things that I do is that I am very evidence-driven, which is important in any kind of science-backed profession, is you need to have evidence for why you're doing something. And the original idea came from when I was in a clinic and I was like, oh, these guys locked away their ultrasound. That way I have to charge for every ultrasound I do. But it's so easy for me to put this ultrasound on a patient and get some very useful information. And I remember in that moment thinking, that was very clever of them to lock the ultrasound so doctors can't do it for free. But I was also kind of under the realization of, such an easy diagnostic to be able to rule out such a serious condition, why not include it with the exam? Same thing happens with our venipuncture, including packed cell volume, lactate, blood glucose, UN values. All of these point-of-care diagnostics cost maybe $2 a run. We should include this with our exam and give this immediate triage data to our clients to be able to help guide them with care. So no longer are you getting just a doctor's opinion about what's going on with your patient, which is valuable, but also you're getting evidence to say, do more diagnostics, get more blood work. Your patient's stable. There's no changes in lactate. We can calm down a little bit. So that has evolved in our practice in regards to that. And of course, we have AI coming into the hospital, and it does all of its AI things. So that can be a fun conversation, but not the point of today. One thing that I wanted in our hospital is this distributed autonomy model, which is basically I wanted my team to have the ability to make decisions for patients, rather than waiting for a doctor to come to a patient and saying, hey, we need to run ketones on this patient because the blood glucose is over 600 and I'm worried about diabetic ketoacidosis. I wanted my team to have the ability to say, run the stupid test. They can do it. They've seen enough of those cases, they can figure that out quickly. And that's one of our models or pillars. Last little bit about the clinic, just personal, proud of these facts. Our first year being open, we saw 2,900 patients in our first year alone, just working Friday through Monday. Went from starting with a team of 7 to the end of 2025 with a team of 12. Grew from 1 doctor working 72 hours every weekend to having now 4 doctors and finally getting to work 12-hour shifts, which I greatly appreciate. We are now about 15 team members. We saw on our first 2 months being open 650 patients, which is showing that we'll probably have about 5,000 patients in 2026. So there's a very desperate need. I actually was looking at number of physicians to people and number of veterinarians to people, and I think it's like, I want to say 1,000 people to every physician, and something like 100,000 people to every veterinarian. So there's a desperate need for more veterinarians. But I also want to talk about the desperate need for all of these roles too. So we have on here some of the various roles that you'll see in veterinary medicine, starting with your administrators. These roles are typically composed of people who have practice management experience, learning how to manage team members and manage clients and their expectations, helping make clinic flow better. A huge difference in having people who are, well, I don't know where to go with that problem. I don't know how to help solve that issue, to being, hey, my practice manager is going to help you with this issue. They're going to solve this for us. Or being able to say, the floor is slammed all the time. How do we make this easier? And a practice manager has the ability to see where are we inefficient, where can we improve that. Practice managers are going to have a background in both business as well as kind of veterinary medicine. They are usually going to have a bachelor's degree. They often can make, I would say $60,000 to $80,000 a year is a common salary to see with practice managers. It's going to be a combination of having that true veterinary experience of being in a clinic and seeing how does this work, as well as having some formal education where you have a business mind to be able to say, okay, if we do this, will it financially work for the clinic? Can they make their revenue? Can I please my corporate overlords? So that can all be a component of what a practice manager does. They often come from what's the CSR role. The CSR role is your client service representative. These are entry-level positions into veterinary medicine. They are the first line as far as triaging a patient. When you speak to a veterinary clinic, you are probably talking to a CSR, and they have to have the knowledge to say, yes, that is an immediate crisis, please come on in, or the ability to say, please do not bring your ear infection here at 1 a.m. in the morning. It can wait into the morning, please. As we keep going, I'll also point out support or veterinary nurses, also sometimes called veterinary technicians. This is also an entry-level role into veterinary medicine. Oftentimes you do not need to have a degree for it, but sometimes I do see people who come back from education and say, I really want to get into veterinary medicine. This is the start of that role for them. This is where you're going to learn how to restrain and handle animals, place IV catheters, do venipuncture on these patients. You're going to run diagnostics for the clinicians that you're working with. There are limitations to what you can do because this is not a licensed role. This is, I am gaining skills on the role. We used to grandfather these positions into a CVT position. That has no longer happened. So this role does have kind of a wage cap that you would have in it. It's something that's probably going to be in that, I would say, $40,000 to $55,000 a year is probably a well-paid support or veterinary nurse. Now, the next role there is the CVT, and this is your first license into veterinary medicine. This is what is considered a certified veterinary technician. In some places, this is called an RVT, or registered veterinary technician. This is a 2-year associate's degree where your license is now managed by the veterinary board, and you now have greater capabilities. These roles are going to be basically your leaders along the veterinary nurses and support team. They're going to be able to help direct your other teammates. They're going to be able to do more technical things like intubation is primarily done by CVTs. You're going to place urinary catheters. You're going to run more advanced diagnostics. You're going to scrub into surgery and assist doctors. This is what the CVT role looks like. And right now, there's kind of an interesting political play that's happening around the CVT role because they are almost a nurse practitioner in veterinary medicine, but they have been very pointedly prohibited from doing any kind of diagnosis or treatment of their own. So can they order a test? Yes. Can they interpret that test? No. That's the difference for a CVT versus your veterinarian. Your veterinarian is your next role inside veterinary medicine. This is your true doctorate of veterinary medicine. This is a 4-year degree, typically after a bachelor's, but some people will go directly from their undergraduate without completing their bachelor's into veterinary medicine, provided they got their science GPAs, they're very competitive on paper, and they're kind of those 4.0 students. So it definitely happens. There are some schools and some different countries that actually have different degrees that push these students before they even have their bachelor's. Take New Zealand. New Zealand, you can get a bachelor's of veterinary science, which is equivalent to a doctorate. It's a 6-year program. They are still considered doctors over in the US. Same with Europe. There's some schools that do a bachelor's of veterinary science there as well. One of the schools that I was accepted to was Massey University over in New Zealand, and I was kind of like, I just finished my bachelor's. I'm not sure I want to do another 6 years of school. So I just did 4. Veterinarians are your true generalist as far as veterinary medicine goes. They are your anesthesiologists, your dermatologists, they are your ER doctors, they are your family medicine, they are all the roles that you see in human medicine. This is where the first assessment of the patient comes into. The veterinarian is the one who's looking at this. This role can vary as far as pay quite a bit. Most starting veterinarians right now are probably producing, I would say, $140,000 to $200,000 as a starting veterinarian. The way veterinarians are paid is often through ProSal, production salary. I pay my team hourly because I try to keep production away from that, but I still pay my team over $220,000 a year as far as our veterinarians go. Depending on where you are, how you do production, it can vary. An experienced veterinary doctor over in New York, for example, they're making $300,000 a year. So there are definitely ways that you can see better income as a veterinarian, especially because you get a lot of school debt with that too. Personally, $450,000 worth of school debt. So I'm going to be paying off for some time. That is kind of the difference between your general practice, your specialists. Let's also talk, well, not your specialists, your ER doctors. Let's talk about also industry. Some vets like working with horses. Not me, but some vets like working with horses. I like looking at horses. I don't like touching horses. This is also a very viable way of practicing veterinary medicine, very different. It's going to be more of a rural element. There are a lot of public service forgiveness loans that are out there for these rural veterinarians who are practicing on farms, working with cattle, working with even poultry. You know, these veterinarians are in charge of a huge herd of animals, and they have to be able to help manage that herd safely as far as for our food quality. You also see them working in the government sectors as far as epidemiology, as well as working in the USDA, although currently that's goes up and down, is how I will say that politely. Veterinary specialist now. This is an additional 4-year degree on top of your veterinary education. So consider this a 4-year bachelor's, 4-year DVM. Now you're talking about doing a rotating internship followed by, ideally, a 3-year residency. But many veterinary specialists will instead have rotating internship, specialty internship, second specialty internship, followed by 3 years of your residency until you become a true specialist. So you are talking about probably 10 to 15 years of education. If you are interested in becoming a veterinary specialist, you are not doing it for the money, I'll tell you that. No, you are doing it because the love of the game. You have to love the medicine that much to be able to take it that far. And I'll show you why in this presentation. I threw an extra one on there because it doesn't really belong in any of those categories, but it is something that's becoming more prominent. A veterinary social worker. This is usually a bachelor's to master's level education that's usually worked in specifically social work or in psychology. I had the privilege of working with a veterinary social worker over in Frisco. Very valuable to be able to consult these clients who are riddled with anxiety, with stress, with grief. Being in an emergency situation with your animal who is suffering or having a hard time, you need somebody to help guide you with that. They are often patient advocates, where veterinarians and CVTs and these other roles might have a more abrasive way of being a patient advocate. They are not known for being able to relate to the owner, but to the animal themselves. So it's not to say that we don't care immensely about our patients. It's that we all thought we did this to work with animals, not people. So I have a great case for us to take a look at. If you use that link up there, you'll be able to participate into it. I'm going to go through these a little bit so you can see how each of these roles kind of affects the case. And the first case that we have here is the constipated cat. A challenge for every practitioner. So your CSR has asked you for your advice on a patient waiting for intake. In this lobby, a client is presenting with a 2-year-old male neutered domestic short hair that is very vocal. Domestic short-haired cat, that's your run-of-the-mill normal cat. It's very vocal. You can hear it yelling in the lobby, and the owner reports that the patient's been constipated for the last 24 hours and has been making